Good afternoon, everyone. It's a great pleasure to be your moderator for today's event, The Way Forward for Malaria Elimination, Joint Effort Through Drug Development. I'm Dr. Yuki Lloyd, Senior Manager for Invest for Impact team for GHIT Fund. Today, we will talk about a disease that humans have suffered for a long time and still do, mainly and predominantly in Africa and in other places around the globe, affecting the most vulnerable populations, malaria. Malaria was eradicated in Japan in 1961, but continues to cause a great burden for many African countries, with over 260 million cases each year and causing approximately 600,000 deaths each year globally. Many innovations have been developed to help us reach malaria elimination, but to this day, we continue to see stalled progress. Today, we will discuss how malaria research and development can help us speed up our goal to elimination and bring economic growth, especially in Africa. Now, before we go into the program, we would like to inform you that there have been a late change in the speakers. Unfortunately, Honorable Dr. Aden Duale, the Minister of Health of the Republic of Kenya, is not available to join us today. But we will instead have the honor of Mr. Lokolile Bosco Lolem, representing the Cabinet Secretary of the Kenyan government. Now today, we have a lineup of exceptional speakers who I will be introducing by name, title, and affiliation only. Now, to open our session, it is my pleasure of introducing Dr. Hiroki Nakatani, Chair and Representative Director of the GHIT Fund. Dr. Nakatani has contributed to health both nationally and globally through his various positions within, but not limited to, the Ministry of Health, Labor and Welfare in Japan, and as Assistant Director General of the World Health Organization. Dr. Nakatani will start our discussion today on the joint effort through drug development. Dr. Nakatani, over to you.
Hello, I'm Mr. Lolem Bosco Lolem, representing Ministry of Health of Kenyan government. Madam Christina Domini, Executive Vice President of Medicine for Malaria Venture. Dr. Inaoka Ken Daniel, Professor, Institute of Tropical Medicine, Nagasaki University. Dr. Takaya Kenji, Senior Scientist, Shionogi Company Limited. Also, I recognize Dr. Michael Charles, CEO of RBM Malaria Partnership. Thank you for coming. Distinguished participants and ladies and gentlemen. It is a great honor to be with you today. My name is Hiroki Nakatani, Chair of the Board of Directors of the Global Health Innovative Technology Fund, GHIT Fund, from Japan. This fund was launched at 2013 session of Ticket 5 in here in Yokohama in 2013. Our aim is to reduce misery caused by tropical disease, tuberculosis, and malaria by connecting Japanese science and technology with global partners. This vision has been supported by Government of Japan, UNDP, the Gates Foundation, Wellcome Trust, pharmaceutical, and other industries globally. GHIT believes that Japanese innovation can make a greater contribution, not only to the global health, but the well-being of the Japanese citizens. I remind myself always that Japan is a country that developed freeze-dried vaccines, BCG, and which provided with free of patent. That contributed to the global public health. And also, our nationals, Dr. Satoshi Omura, this discovery of ivermectin has played a key role in eliminating liver blindness in West Africa. These powerful examples of science of Japan contributing to humanity. Today, 22nd of August, is a special day, particularly this year. Why? I'm afraid it's not my birthday. 170 years ago, on the same day, 22nd of August, Dr. Robert Koch, who came to Japan by the invitation of a very famous man who is founding dean of my university, which I graduated from. He appears on 10,000 yen banknotes, Shibasaburo Kitasato. He was a good student and also collaborator of Dr. Koch. And Dr. Koch came to Japan, and everybody was excited to hear his insight of how to conquer tuberculosis. He was known as a discoverer of tuberculosis bacilli. But surprisingly, his last lecture before departing Japan from this Yokohama port on the 22nd of August, his lecture in a noble's house was outstanding. The theme was not tuberculosis, but African sleeping sickness. He thought that is a global threat for the humanity. Today, momentarily, there was celebration to have Noguchi Prize Award giving ceremony in Tokyo. And this year, our good partner, DNDI, is a laureate of the Noguchi Prize because of their long-standing commitments to developing NTD drugs, including that of sleeping sickness. Today, sleeping sickness can be curable by completely oral medicines. So that says that power of innovation. Let's talk about turning to malaria. It continued to take over 500,000 of lives each year, mostly children in sub-Saharan Africa. Beyond that tragic loss, malaria also holds back economy. A recent report from RBM Partnership that estimates that reducing malaria cases by 90% by 2030 could boost African GDP by 126 billion US dollars. Supporting health is important for Africa, which is now a vibrantly growing continent. And it is not only a moral imperative, but an investment for the future. That is why we must continue our investment in better vaccines, better medicine, better insecticides for malaria. Also, at the same time, we are now facing new pandemics or epidemics now. That is not COVID-25, but acute global health mania. So resource shortage. The global health landscape is becoming more difficult. The last OECD report warns that cut off official development days from their member countries. By 27, total ODA may fall back to pre-COVID eras. And health-related bilateral aid could be hit even harder. This moment challenges us to be creative and bold. When resources are limited, we must respond with smart solutions and strong action. We need to invest in research and innovation from the start. Healthy populations leads to stronger economy. But innovation must be connected to manufacturing and access strategies so that life-saving tools can reach the people who need them most. This is why strong partnerships are needed. As an organization focused on R&D, GHIT is committed to do its part. Let me close my remarks by reaffirming GHIT's deep commitments to work with all of you as partners to defeat malaria. I thank you very much.
Thank you so much, Dr. Nakatani, for the inspiring opening note and for the surprising coincidence with Dr. Koch's departure, and also emphasizing on the importance of strong partnerships during this difficult time. Okay, now I would like to welcome on stage a very distinguished panel to discuss the topic of malaria R&D and how it relates to growth in Africa. Speakers, please join us on the stage. Thank you. Although we are eager to hear a lot from them, to make the most of our time together, I ask all panelists to please keep your answers within 3 minutes. Firstly, I would like to welcome Mr. Lokolile for his input. Mr. Lokolile, are you ready? Great, thank you. Could you please explain how the burden of malaria affects trade and also development in Africa? Over to you.
Yes, thank you, Valentina. Excellencies, distinguished delegates, ladies and gentlemen. We are really honored as the Republic of Kenya to be part of this, and our cabinet secretary had a real plan. However, he had just left because of exigencies of duties. And again, we are also honored to have one of us who is our technical lead, Dr. Muleshe, just came in from another event. He's our head of international health relations. And so we really take this with a lot of importance, and really appreciate MMV for having taken this opportunity to give us the lead in terms of talking about this. For us, malaria remains a key socioeconomic and public health problems, and really affecting about 6 million of Kenyans annually, with 70% of our people at risk of malaria. And up to of the 47 subnational levels, counties, 29 are malaria endemics, including many of the counties in all the subnational levels in Western Kenya, Nyanza, Homa Bay, Kisumu, and many. So it's a huge issue. It's a huge socioeconomic issue. And to also note, malaria remains really beyond the health burden. Malaria cost Kenya an estimated up to 2% of our GDP. And so it's a huge issue annually to the loss of productivity, school absenteeism, and out-of-pocket cost in terms of our households. So it's a really huge problem, and I believe that is what we can say about the socioeconomic cost of malaria. But a lot is there in terms of the impacts.
Thank you so much, Mr. Lokolile. Now I would like to welcome Dr. Christina Donini who is the head of R&D at MMV, to tell us more. Christina, what are the main factors hindering malaria elimination in Africa from the perspective of a leading PDP specialized in R&D and access? Please.
Arigato gozaimasu. That's the max I can say in Japanese. Apologies. Malaria, we have heard it, is a disease of inequity. It's a consequence of poverty, but it's also a cause of poverty. So definitely fighting malaria will help the social economic situation, particularly in the African continent. So what is hindering the elimination? I would like you to take home several factors are hindering, but in summary, I would think that first and foremost is biology. Biology is fighting us back. The mosquitoes are getting resistance to insecticides. Parasites are getting resistance to drugs. And if we think about what WHO is forecasting is if partial artemisinin resistance that we're seeing in Africa, we have seen frank resistance in the Great Mekong region in Asia. If what happened in Asia happens in Africa, that's going to be a huge toll for the African continent and for the humanity. And WHO is forecasting that we could have 16 million more cases in the continent of Africa, which could cost $1 billion at least to the continent. So we need to stop this now, and this cannot happen. Funding is also a factor. There is a fatigue in funding, and there is also competing priorities. If you think about what happened with COVID, when COVID hits, malaria resources were diverted to response to an emergency such as a pandemic. When conflict strikes, malaria resources are taken away. Health systems. We have weakened health system in the field. So we have stockouts for drugs. We have limited diagnostic capacity. We have a shortage of trained staff. And surveillance often misses the cases of malaria where transmission is happening until it's too late. And last but not least, climate change. Climate change is a reality and is shifting the goalpost. So we have changing rainfalls, we have temperature patterns that are changing, we have the mosquito that is surviving at higher altitude, and we have the prolonging transmission of seasons. So the season lasted for a long time. So to truly eliminate this disease, we need targeted and high impact innovative medicine. We need a sustained political will, and we need investment. We have heard it from Professor Nakatani. We need to have a continued investment to match the scale of the challenge that we have ahead. And MMV is part of this fight. Thank you.
Thank you so much. So we just heard about the huge socioeconomic burden that malaria causes, and it's not just a health burden, but also affecting productivity, schools, and also out-of-pocket costs of households. And the hindering factors, Dr. Donini mentioned that this is a change in biology of mosquitoes and parasites. Not only that, but also the funding landscape and also the climate change as well. Now, taking that into consideration, we would like to move on to Japanese involvement in addressing the burden of malaria and benefits for research and development for Africa. Now, I'd like to turn to Dr. Daniel Ken Inaoka, who is a professor at the Institute of Tropical Medicine at Nagasaki University, to hear more about the Japanese involvement from an academic point of view. Dr. Daniel, please.
Okay, thank you. I'm Daniel, as you mentioned, from the Nagasaki University. So I'm going to talk about a little bit about the Japanese academic contribution in R&D for malaria. So the Japanese academic institutions have been growing role in the malaria R&D. And institutions from Japan, like Nagasaki University, from NECCAN, and also from Osaka Metropolitan University, and Ehime University, and Tokyo University as well. They have been playing a leading role in the development of vaccines, drugs, and diagnostic tools. And also in clinical trials and epidemiological research. So collaboration with these African universities and research centers, Japanese scientists have contributed so far into R&D by three main topics. One is identifying new drug candidates from unique chemical libraries through partnerships such as with GHIT and AMED, and also linking Japanese pharmaceutical and academic innovations with global partners such as MMV. Okay, so and also second, I would like to talk about conducting clinical trials, mostly from Japanese academic institutions from vaccine and diagnostic field, in endemic settings, often through partnerships with African counterparts like Kenya, Ghana, Uganda, and Burkina Faso. And third point is a contribution into basic and translational research, of course, since we come from academia. So we inform the biology of malaria parasites and also study and contribution in the understanding the resistance of the parasites. So beyond R&D, so we can list a few. One is, of course, capacity building. So we, through the, for example, JICA-sponsored programs, we train African people like scientists, physicians, and public health experts in the field of entomology, pharmacology, and clinical research. And also, we contribute quite a lot in the infrastructure development and also health system strengthening. Okay. Thank you.
Thank you so much, Dr. Daniel. Now that we've heard the academia perspective, we'd like to move on to the private sector. I'd like to come to Dr. Takaya Kenji, who is a senior scientist at Shionogi Company. Please.
Thank you very much for the organizers for giving us this opportunity. My name is Kenji Takaya. I'm a scientist in Shionogi. Shionogi is a Japanese pharmaceutical company that has its focus and strength in the infectious diseases. And we have the track record of the research and development in the antibacterials and antivirals. And we started working on malaria, which is a parasitic disease, from 2019, together with Nagasaki University. And we are currently, later the MMV joined us, with us, and some of our projects are funded by the GHIT fund. And I've been leading these projects from the outset of this collaboration, and we are really happy to work with all these partners. And in malaria, I think there's two major needs. The first one is that a new drug to fight against the drug resistance, as Christina mentioned. The drug resistance means that the drugs lose their efficacy because the malaria parasites evolve to survive the drug treatment. So this is becoming a big issue in African continent because the drug resistance parasites are increasing in Africa. And MMV and its partners are working on this issue, including us, and trying to find new drugs with novel mechanisms. And good news is that thanks to the decades-long efforts of MMV and its partners, we now see a promising drug candidates in the clinical in the pipeline, and especially in the clinical later stage clinical trials. And I just hope the success of these clinical trials and save many lives. And the second big need in malaria, I think, is that prevention drugs. Malaria is a disease that its symptom gets quite worse very, very rapidly if untreated. So that's why, and many children dies before they reach the healthcare and medicines. And that's why we are working on the prevention drug. And that allows, ideally, the 6 months protection just by the single injection. So you give the single injection, you are free from malaria for 6 months. That's what we are aiming for. And this is called a long-acting injectable. And I hope this new technology will help a lot of our lives and global malaria elimination efforts.
Great, thank you so much, Dr. Takaya. Okay, now I would like to ask for your opinion, Mr. Lokolile. Having heard the contributions from Nagasaki and Shionogi, especially in drug discovery, clinical trials, and also epidemiological research, and also around strengthening capacity by the assistance of JICA and the government of Japan. And also from the industrial point of view, the collaboration of Nagasaki dates back to 2019, and Dr. Takaya touched briefly on drug resistance, and also the necessity of a drug, a promising drug with novel mechanism. And also he touched on the long-acting injectables as a single-dose prevention drug. But with all of that, could we hear how R&D from malaria medicines is affecting capacity development in Africa from your perspective? Mr. Lokolile, please.
Thank you, Valentina, and thank you, colleagues. Yes, the issue of malaria, and we've said, is not just a public health issue, but we've seen as a productivity and development issue. So ending it is a matter of national survival and economic development. And so it's something that as we promote Japanese technology, the perspective toward recognizing that our traditional tools that we've been using over years, while we agree that they have been impactful, we now need to really move to the most progressive tools that demand so we demand a paradigm shift powered by the new innovations, new treatment options that are available. And so we need the investments, the bold investments in gene-driven mosquito research, the AI-driven vector surveillance systems, molecular diagnosis to detect subclinical malaria, and digital cross-based surveillance. And so research and development is critical in as our most strategic lever, and Japan's global leadership in technology, precision diagnostics, and health systems designs can be a decisive accelerator in the journey. And so Kenya's leadership, and as the minister had indicated, is proud to be at the forefront of malaria research and local innovations. And so we are currently engaged in testing new vaccines, including the RTS. We also are piloting the Systemax XN31 AI-enabled diagnostics. We are at the same time also started using drones and AI-based vector mapping in collaboration with SORA technology. And we also, under the PHC program, are partnering with Aiken Chemical to deploy rapid diagnostic testing through our primary health care initiatives. And the SHA Financial Primary Care is also supported by a wide array of community health promoters, over 100,000, who can reach the households within specific time. And so our institutions, Kenya Medical Research Institution, the National Malaria Program, and also some of our higher learning institutions, Mount Kenya University, Maseno universities, have taken up the capacity initiatives in terms of promoting R&D, and the ministry leadership, the government is really supporting and really welcome the innovative technology, innovations, and aspirations that we are getting from our friends from Japan and the global community, and really thank MMV for the connections that is coming. Yeah, thank you.
Thank you, Mr. Lokolile. Now, Mr. Lokolile talked about innovation to move from traditional tools. But now I would like to ask Christina, in the next 5 to 10 years, what are some of the innovations that need to be developed to speed up malaria elimination, and what is limiting their development?
Thank you. Innovation is needed across all fronts. We need innovation in the delivery of care. We need innovation in diagnostic. We need innovation in the vector control. We need innovation in vaccines. But what I would like to focus the discussion is on medicine. This is what MMV does. MMV is a product development partnership, and our mission is to discover, develop, and deliver affordable medicine to the population that needs it the most. And I think that the key word is partnership. As Martin, our CEO, says, we can't do it alone. It's not one single organization, it's not one single academic group or one pharma partner that can do that. We need to, together as a community, work towards the goal of eliminating the disease. Let me give you a couple of examples of partnership. So we've talked about AI. I think that, can AI help the drug discovery of molecule for malaria? Of course it can. And we have started a collaboration, thanks to GHIT, with L-Pixel, is a startup company here in Japan. And they're helping us in deconvoluting mechanism of action. We need new molecule with new mechanism of action. And through cell painting and imaging, maybe we can discover new drugs and allow us to be more targeted towards novel mechanism of action. We need to be smart with the molecule and the medicine that we have today. The ACTs that we have today in the field are working. They're not losing the clinical efficacy. But we need better tools. And so what can we do now in order to manage the resistance that we have? We're working with Marubeni here in Japan, Moro in Thailand, and Fosun in China to develop the first triple ACT, so adding a component to the current drugs to manage the resistance. And on the prevention side, Dr. Takaya stole my thunder on the long-acting injectable, but we're working with Nagasaki and Shionogi. Again, thanks to the GHIT who brought us together as a partnership. And we're looking to this transformative tool that could actually change completely the prevention and the elimination space. So today, the chemopreventive drugs that we have complex regimen. They have to be given for several days and for several months during the rainy season. Imagine if tomorrow we can have one single shot of two drugs together, or one drug like Shionogi is working on, that can protect the individual, not only the children, but all ages, for 3 months or maybe the entire season. That would be absolutely transformative in the field of malaria. And I would like to thank the Japanese government that through GHIT funding and the pharma here in Japan has helped us in bringing the pipeline where it is. A third of our pipeline in discovery is supported by GHIT funding and is done in collaboration with academic in Japan and Japanese pharma. The limiting factor for the developing a drug is extremely complex. We have scientific complexity, we have funding difficulties, we have different priorities at the governmental level. But I'm an optimist, and I do think that actually with the right partnership, we can do it. And I think we need to bring Africa at the forefront. We are working with Africa in clinical development, but there are a lot of research centers that we need to bring together. And I imagine this magic triangle of Africa, Japanese R&D, academic, and PDPs like MMV, and we can make it happen. Thank you.
Thank you so much, Christina, for not just bringing up the innovations and also the challenges, but also bringing up solutions as well, which was focused around partnership. Now, in order to bring innovation, there are obviously challenges. Always there are challenges. Now, I would like to ask Daniel the question is, what are some of the challenges you face in pursuing research and development for developing medicines for Africa?
Okay, thank you for the question. From let's say Nagasaki University's point of view, of course, the main gap is, as Katena mentioned, is gap in funding. So the funding not only for advanced stage, but funding for the early stage. Although, of course, GHIT has good, excellent platform for screening system, but not all our, let's say, Japanese academic colleagues have access to this kind of findings in collaboration with, of course, for example, MMV and also the library holders. And also another gap that you can see from the kind of point of view is the lack of individuals that are, capacitated individuals who can work with us in this field. And also, from, let's say, in more broader point of view, so we have also problem with limit of incentive in the market for, not only for me, but also from the pharma company side. For example, pharmaceutical companies often perceive low commercial returns on anti-malarial drugs. So Japanese R&D actors who rely heavily on public funding must work harder to justify investment in global health products for low-income markets. And another challenge that we can see, I'm going to mention not all of them, a few of them, is the challenge in the research equity and also brain draining. These are because ensuring equitable outputs, fair data sharing, a long-term collaboration with African partners is still an ongoing challenge. Additionally, trained Africans researchers often migrate abroad, so reducing the local capacity in the local. Okay, and overcoming these challenges required coordinated policy support, and of course sustainable funding models and commitments to cooperation with African partners. Okay. Great. That's my point of view. Thank you.
Great, thank you, Daniel, for that. So Daniel touched on items from funding to also keeping talent, local talent on the ground. But next, I would like to ask Kenji, Dr. Takaya, for how do you see the future of Japanese pharmaceutical industry in developing medicines for Africa? And are there plans for research and development and manufacturing in Africa?
Okay, in Africa. Okay.
In Africa, yes.
When I looked around this TCAT event, what I saw was that new ideas, new technologies to contribute to the health of the African people. And I just want to add that the Japanese pharmaceutical companies are also doing a lot of job in this field. When I look at the MMV's, the GHIT's, the investment portfolio, we can see a lot of the innovative projects going on in the malaria and in the other diseases. And not only for the drugs, but also vaccines and diagnostics. We need a holistic approach. And so we need a holistic approach. And what is it? And this is not example from the pharmaceutical industry, but you know the long-lasting insecticide-treated bed net. This is the essential tool to fight against the malaria. And that was developed by the Japanese company, Sumitomo Chemical. And I think the track record and the future outlook of the Japanese company's contribution to the global health is quite promising. And when it comes to the R&D in Africa, I think that is already happening to some extent in Africa. I think that there's already the great researchers like Professor Jimde, who got the Noguchi Hideo Prize this year. He's the expert in the field studies, clinical studies based on the molecular genetics. And actually, we are working with him to some extent through the MMV's partnership. This is the one example of the advantage of the working in the partnership. And another prominent example is the Professor Pikeli Chibale, who is coming from the South Africa. He's a very, very well-known medicinal chemist, and he's the leader of the Drug Discovery Institute in South Africa. Led by these great researchers, I think the research and development capability in Africa will definitely grow. And as we can see more research output, the involvement of the pharmaceutical companies will naturally grow. I think we are on the right way for the development in Africa. And as for the manufacturing in Africa, as far as I know, the MMV is working on that issue. They are working with the African manufacturing companies like the Universal Corporation in Kenya to manufacture the drugs for the African people. And this effort will also definitely increase the manufacturing capacity in Africa. So from the pharmaceutical point of view, we would love to see more quality manufacturers in Africa for the future collaboration and business opportunities.
Great, thank you, Kenji, for that remarks. And we're relieved to hear that the situation is very promising in terms of manufacturing, but we need to make sure that the quality is there. And everyone highlighted the importance of partnerships in their comments. But since we have a little bit more time, I'd like to go to our closing question to all of our speakers. In just 1 minute, what do you think is the single thing African and Japanese governments together can do to help eliminate malaria in Africa? Maybe we can start from Mr. Rokolide.
Okay, thank you, Valentina. Yes, yes, it's in a minute, but it's a statement for the cabinet secretary that he was supposed to read. So, and he says that I wish to commend the Medicines for Malaria Venture and other partners who have consistently invested in innovations, partnerships, and the development of life-saving tools. Your work demonstrates the power of collaboration between governments, research institutions, and the private sector in driving progress. As African nations, we must commit to strengthening our research ecosystems by investing in local institutions, building human capital, and fostering regional collaboration. We must also ensure that innovations reach the communities that most need them through strong health systems, equitable access, and affordable solutions. And so Kenya reaffirms its commitment to working with regional and global partners, particularly our friends Japan, in fostering and accelerating malaria research and development, scaling up proven interventions, and ensuring no one is left behind, and in the journey towards a malaria-free Africa. And for that, we thank you. Arigato. Thank you.
Okay, if there's one thing that African and Japanese governments can do together to eliminate malaria in Africa, could be to co-invest in regional centers of excellence to malaria research implementation. We still have several these centers of excellence funded by Japanese government, but we still need more. So these centers, joint funded, co-managed, and regionally distributed, could conduct context-relevant R&D, train next generation African and Japanese scientists, which is more relevant, more important for the academic point of view, and also translate innovations from these partnerships into national policies and also practice. So this would not only accelerate the development of new tools, but also empower African systems to lead malaria elimination from within, with Japan as a long-term partner.
Well, my message is to keep advocating the malaria as a global issue. Malaria was once anywhere in the world, including Japan, but it was now largely contained in the African continent. But we now have the resistance issue. We now have the climate change. We now have the funding cut. We now have more people going to and coming from Africa, like today. So we are at risk of the resurgence of malaria. So I believe if we can share the same sense of emergency and the same goal for the malaria-free world, we can eliminate malaria. So as a scientist, I hope the drug I'm working on will be a help in the future. Thank you.
Well, I don't know what to add. They said it all. Africa has the on-the-ground experience. They had fantastic clinical facility. They have the know-how of the disease, of the epidemiology of the disease. What Africa is still missing is the R&D, is the research part. We have seen Professor Kelly Chibali has done it. So if Kelly can do it, anyone can do it. But they need investment. They need the government that sees this as a priority. When I talk to scientists in Zambia, they say, I need to send my sample in Mali to get analyzed. That takes months. And so when we're talking to a medicinal chemist here in Japan, they open their eyes and they say, oh my God. So we need to help them. The infrastructure is there, the knowledge is there. We just need to help them, particularly with the excellence of the R&D that Japan has. I think that if we actually put all our minds and money together and will to do it, Africa can have more than H3D in South Africa. They can have in Ghana, they can have it in Kenya. We need to help them in connecting the dots. Thank you.
Great, thank you so much. So the speakers highlighted the important aspect is to keep advocating on malaria, and also regarding research and development, to make sure that the research and development is context relevant, and also focusing on translational research, and to support African governments prioritize research. And as GHIT Fund, we hope to continue supporting collaboration between the public and private sector that was mentioned in today's talk. Okay, thank you so much to the speakers. Since we have maybe 1 minute, we can take 1 or 2 questions from the floor if anybody has any pressing questions. If not, the speakers will be around for maybe 10 or 15 minutes after this event, so you can ask then. Okay, to close our event, I'd like to call on Dr. Michael Charles, who is CEO of the RBM Partnership to End Malaria.
So good afternoon, ladies and gentlemen. Allow me to say a warm welcome to the Honorable Minister of Health for Kenya, ably represented here. Distinguished representatives from Japanese academia, the private sector, our African brothers and sisters that are here, MMV colleagues, the global health community, ladies and gentlemen. It gives me great pleasure to stand in front of you as the RBM Partnership CEO. It's a partnership of over 500 partners working together to ensure that we have a coordinated approach in driving down the burden of malaria. It's also my pleasure to welcome and introduce one of our board members, a health advocate, a lady that is using her voice to represent Africa on the global stage, Miss Yvonne Chaka Chaka, who many of you would know. Thank you for coming, Yvonne, to support our cause. I think we've all heard a lot about malaria, but allow me to use some analogies to put it into perspective and some data. As of 2023, we had over 263 million cases of malaria, and we had almost 600,000 deaths. 600,000 deaths. These are not just numbers, these are human beings. If I break down that number a little bit further, we are losing about 1,600 people every day. 1,600. Allow me to break it further. It is the equivalent of 5 jumbo jets crashing every day, filled with African children, mainly under the ages of 5. That is significant. If one jumbo jet was to crash, it's going to make headlines. We're seeing 5 crashes on a daily basis. That is not acceptable in the year 2025. We need to do things differently. We've heard a lot has been said about partnerships, and I truly believe that partnerships is the way that will get us to the end line. Partnerships in terms of ensuring countries are at the center, partnerships in terms of ensuring that we can work together with the innovators, with the academia, with the researchers, with the likes of MMV and others. Partnerships in terms of capacity strengthening, and we've seen and heard it today that capacity strengthening of our colleagues on the African continent is also part of the solution. And at this stage, I'll also like to join my colleague, one of the panelists who mentioned Professor Abdoulaye Jimde, who is receiving an award today in a couple of hours. And that is real true partnership in terms of really building and strengthening the capacity of our brothers and sisters on the African continent. Over the last 3 days as well, we've heard about co-creation. We've heard about looking for solutions, not just using the investment and the funding and the technology from Japan, but really also looking at some of the African solutions and how do we merge them together to ensure that co-creation, that agility that is very much needed. From the RBM Partnership perspective, this is exactly what we think about. It's about putting countries at the center, it's about partnerships, and it's about really ensuring that we can have a big push towards ending malaria. I like the final statements from the colleagues on the panel in terms of what we all need to do collectively. Allow me to end on two philosophies. The first one is the philosophy that's started here in Japan called Kaizen. Kaizen is everybody doing their own part to make a difference, to make the world a better place. And that's something that Japan has really taught us how to do, and this is something that we'll definitely embrace moving forward. I think the second philosophy is coming from Africa, which is Ubuntu. Ubuntu means I am because you are. We coexist, and we cannot live without each other. So on that note, allow me to end on three key words. First, we need to continue to ensure that countries are at the center of anything we do. The second is we need to continue to co-create. It is only when we can co-create together that we'll get a nice product. The third is we need to continue to collaborate as much as possible. Collaborate with yourselves, collaborate with others. And although I said three, I'm adding another one, which is to co-imagine. Let us co-imagine a world free of malaria. Let us co-imagine a world where a child doesn't have to die of malaria. Let us co-imagine a situation whereby, which I've noticed many times, I see a child go to school today, in the next 2 days, the child is dead because of malaria. Let us co-imagine a world free of malaria. Zero malaria starts with me. Zero malaria starts with you. Zero malaria starts with all of us. Thank you so much. Thank you to the government of Japan, and thank you to MMV for putting this together, and to GHIT and everybody. Thank you so much.
Thank you, Dr. Charles, for that powerful message. And I'm sure we will all take back that message, Ubuntu, to work together, to coexist together, and the importance of partnership. Now that brings us to the conclusion of today's program. We are deeply grateful to all our distinguished speakers and also the audience for joining us. Thank you once again. これでイベントを終了いたします。本日はご来場いただきありがとうございました。